Next week is Thanksgiving. It is certainly one of my favorite holidays. But this year, it simply has to be different. I'm encouraging everyone to please do the right thing and avoid having Thanksgiving with anyone outside of your household. Today, in fact, the CDC announced clear recommendations that people should not be traveling for Thanksgiving to visit friends or family, especially if someone from your household or someone that you may be visiting is at risk of getting very sick from COVID-19, like the elderly or people who may have underlying medical conditions. The smartest thing is not to gather. Perhaps you can drop some food off on the porch of your loved one so they can enjoy your cooking, but you do not go inside the house. You can set up virtual conference calls. You can use Zoom so everyone can call in at the same time and say what they are thankful for. Indoor gatherings are a major way that COVID-19 is spreading right now. And at the rates we are seeing in the state, it is very likely that if you are gathering for Thanksgiving, the virus will also be around the table with you. Bad decisions made at Thanksgiving will mean people will be mourning the deaths of their loved ones by New Year's. And so I would rather make smart decisions now and look forward to next year when we can celebrate them again together, alive. Let me talk a little bit more about the COVID vaccine. So there are 2 vaccines that have shown promising data thus far in phase 3 clinical trials and that may be available for distribution before the end of this year. When those vaccines are approved by the CDC, our state will be ready to oversee distribution of them, working with hospitals, local health departments, and community partners. I can tell you that I have reviewed and I do trust the process that is currently being moved forward by the FDA. A group of accomplished public health and medical experts will have to review the data and the science around the vaccine before it is made available. And after it is out in the public, there are systems in place so that any potential adverse reactions are appropriately tracked and monitored and reported. This is exactly what happens for any vaccine, and there are even more systems in place for a COVID-19 vaccine. Only if the data and the science and national experts tell us that the vaccine is safe and effective will we be distributing it here in Michigan. As the governor mentioned, because there will be limitations on the number of vaccines available, especially in the beginning, the initial groups to be vaccinated will be critical workers in our healthcare systems, people working in hospitals, first responders, and those who are most vulnerable for severe illness. It will likely be well into the spring before the general public has access to the vaccine. And that's why it's really just so important that we continue to focus on these preventive measures, wearing masks and maintaining 6 feet of distance so that we can bring this curve down again. Even as our hospitals are overwhelmed, I want to continue to reiterate that people should still seek out medical care if they need it. And especially if you are having an emergency, you should contact your doctor or go to the emergency room. One thing actually that we are concerned about is a shortage of donated blood. Many people are still undergoing important medical procedures or they have urgent medical conditions that require a blood transfusion. A shortage of blood can have devastating consequences. And one important thing people can do right now is donate blood. You can contact your local hospital or the American Red Cross to find out how. I know people are very stressed right now. They may feel like because of this virus, they cannot do the things that they want. But there are actually a lot of things that you can do right now, things that you can control. If you're feeling stressed out and you or a loved one needs help, you can reach out on our website, www.michigan.gov/staywell. There you can find out more about how to speak to someone, about how you're feeling, or you can download some free tools that we have, like Headspace. As I said earlier, you can also download the My COVID Alert app to help with contact tracing efforts. You can and you should get a flu shot this year and prevent a surge of both flu and COVID this winter. As I said before, you can reach out to your local hospital or the American Red Cross to donate blood and help those who may need a life-saving blood transfusion. You can and should get a test if you feel sick and stay at home so you do not infect others. You can and should wear a mask to protect yourself and your loved ones. While these are very scary times, I'm very proud to be a Michigander and of how we came together this spring to bring the curve down, and of all the important and right choices that many people are making every day, not just to protect themselves, but to protect their family members, their community, and their loved ones. While I'm very concerned about our numbers, I know that we can do this. Stay focused on what you can control, be patient, and do the right thing for your own health and the health of your family and the community.